At Carepatron, we are constantly looking at ways to improve. If you have any feedback on how we can improve our videos and resources, please leave us a comment in the comment section below. An electrocardiogram, commonly known as an ECG or an EKG, is a vital tool for measuring the heart's electrical activity. It's used to detect abnormal rhythms and diagnose conditions like arrhythmias, heart failure, or an enlarged heart. By assessing voltage changes in the chest, the ECG provides a visual graph of the heart's electrical function, offering insights into a person's cardiovascular health. A normal ECG values chart is a reference tool used to interpret these ECG results. It contains standard values for what is considered normal in an ECG reading. By comparing a patient's ECG results to this chart, healthcare professionals can quickly identify any irregularities. However, it's important to remember that each patient's heart is unique. Factors like age, gender, and medical history can influence ECG readings, meaning that what's normal may vary from person to person. Sometimes further testing or specialized evaluations are necessary to get a complete picture of the patient's heart health. To help you interpret ECG results more effectively, we've created a free printable normal ECG values chart template. Here's how to use it. Download the chart. Start by downloading the chart from our resource library, which you can find linked in the description below. Explain the form. When you share the chart with your patient, explain how it works. Point out the sections that show ECG readings and their normal ranges. Enter patient data. Fill in the patient's information including age, gender, and any relevant medical details. Conduct the ECG test. Prepare the patient and administer the ECG test. Once completed, record the results on the chart. Review the results. Compare your patient's ECG readings to the normal values on the chart. This will help you evaluate their heart health and determine if any action is needed. Discuss with the patient. Finally, discuss the results with your patient, answering any questions they may have. Ensure they understand the importance of following any recommended treatment plans. Reading an ECG involves analyzing several key components. Heart rate. A normal heart rate is 60 to 100 beats per minute. You can calculate this by counting the R waves in a 6-second strip and multiplying by 10. P wave. This represents atrial depolarization. The P wave should be upright and uniform with a duration of 0.06 to 0.12 seconds. Abnormal P waves might indicate issues like atrial enlargement. PR interval. The PR interval measured from the start of the P wave to the start of the QRS complex should be 0.12 to 0.22 seconds. QRS complex. This represents ventricular depolarization. The duration should be less than 0.12 seconds. ST segment. This flat isoelectric section allows the QRS complex. Look for ST elevation or depression. T wave. The T wave indicates ventricular repolarization and is usually upright. QT interval. Measure the QT interval and correct it for heart rate using Bizet's formula. Normal QTc values range from 0.36 to 0.44 seconds. U wave and Q waves. The U wave is small and follows the T wave, often seen in hypokalemia. By carefully analyzing these components and considering the patient's clinical context, you can accurately interpret ECG results and make informed decisions about their heart health. Here is a sample of our normal ECG values chart to give you an idea of how it can be used in your practice. To explore more of our free templates, visit our templates library on the Carepatron website, linked in the description below. Carepatron is a practice management software known for its comprehensive features, and signing up is free. Just click on the sign up link in the description. If you found this video helpful, don't forget to like and subscribe for more content like this.